Hi, I'm Craig, a psychiatric nursing student at MacEwan University. Welcome to our Nursing 251 video on syphilis. The following information is from the Public Health Agency of Canada. According to them, infectious syphilis, including primary, secondary, and latent stage, is the least common reported bacterial sexually transmitted infection. The numbers are rising in males and females, however, it is more so in males. There have been outbreaks worldwide and in Canada in major centers like Vancouver, Calgary, Edmonton, Halifax, Montreal, Toronto, and many more. Most cases come from men having sex with men or sex trade workers, although there are localized populations that do not fit into these categories. According to statistics in Alberta and British Columbia, Indigenous populations are disproportionately affected by STIs. The following dramatization is a story about patient John, who has contracted syphilis. Please join us as we teach him about his infection, primary ways to prevent the spread of the infection, and ways to treat it. Thank you. Hope you enjoy. Come in.
Hi, my name is Brittany. I'm going to be your nurse today. We're just going to do a quick set of vital signs, going to do an assessment, see how you're doing. Could I just look at your wristband for 1 sec? Get your last name, your date of birth.
John Smith, March 12th, 1978.
Okay, great. Your vitals are all done now. I'm just going to go grab one of my colleagues. They're going to come in and do a blood test just to rule out to see if there's any, bacteria, viruses in your blood. And then the doctor is going to take a look at your blood test and we're going to see what's going on.
Okay.
Sound good?
Thank you.
Okay, I'm just going to go grab my colleague.
Okay. Come in.
Hi, I'm Alicia. I'm one of the nurses that's going to help you today.
Okay.
I will be taking your blood for your blood test.
Okay.
Okay, I'm just going to swab. It's going to be a little bit cold. Okay. So I got everything. The doctor will come in about an hour or so and they'll let you know what's going on.
Okay.
Thank you.
Thank you. Come in.
Hi, John. My name's Dr. Erica, and I'm here to tell you that the lab results have come in and you have syphilis.
Oh my gosh.
Right? The nurses will talk to you about that.
Oh, thank you.
Have a nice day.
Come in.
Hi, John. How are you?
Good. How are you?
I'm good, thanks. We're just gonna get into some quick questions, ask you about your history, if that's okay.
Sure.
Yeah, so do you do any drugs, first of all?
No, I've never done drugs. No needles.
No, never before? Okay,
No.
That's great. That's really, really good. How about any, do you know of any family history of syphilis in your...
No, not that I know of.
Not that you know
No.
of?
My mom died pretty young and my
Mhm.
dad left when I was even younger, so.
Okay, gotcha. Are you sexually active at all?
No, I that's why I don't know how I got syphilis. I've never had sex. I'm a virgin.
Okay, well, there is the possibility that if your mom had syphilis, it could have been like transferred to you like through the placenta when you were like in the womb sort of thing. That's always a possibility.
Oh,
that could
okay.
be the situation here that could explain it. Have you ever noticed before that you ever had any like small little sores on your body? Like they would probably be painless, maybe have some fluid coming out of them.
Yeah, there was a couple years ago I'd fallen asleep in my garden, and when I woke up I had a bunch of red bumps on my arm. I just thought they were bug bites.
Yeah, it probably wasn't bug bites. It was probably what they call their cankers. Like I said, they're just like small little painless spots that you can get with the primary stage of syphilis.
Oh, okay. So would they have like, sometimes they leaked a little bit.
Yeah, that would make sense. Lots of the time there's like fluid coming out of the cankers. And a lot of people kind of like will confuse them with something else. Like you said, you thought it was a bug bite, right? Because it looks like just a normal kind of spot, right? And they're painless, so you wouldn't really think that anything is wrong. But yeah, they're actually associated with the first stage of syphilis. Now I see that you have a lot of rashes on your body. It looks like you have some on the palms of your hands, the bottom of your feet. How long did you say you've had the rashes for?
Oh, not long. They appeared a couple weeks ago, I guess. Yeah, so just kind of suddenly onset.
I'm going to check your mouth now for lesions, if that's okay.
Sure. I haven't noticed anything in my mouth, but...
Yeah, we'll just take a look and see if anything shows. Okay, I'm just going to use this tongue depressor, look around in your mouth, see if we can see anything. Okay, yeah, it looks like you have a few sores in there. Have you had a sore throat lately?
Yeah.
Yeah, a bit of a sore throat.
Feels like I have the flu.
Yeah. Yeah, you do have a little bit of a fever. We took your vitals before and your temperature was kind of high, so.
Okay.
How about, have you had any muscle aches lately? Feeling fatigued? Yeah? So we're done with all the questions. It's really great that you came in when you did, because if your secondary stage syphilis went untreated, you could move on to the latent stage, which was basically you still have the infection in your body, but it doesn't show any signs of symptoms for a long time. You can come back and get the tertiary stage of syphilis, which can lead to all sorts of things like brain problems, sort of headaches, sensory problems. You could have problems with walking, like an impaired gait. You could have vision loss. Central nervous problems, which could involve like headaches, sensory problems. So it's really, really great that you came in now when you did.
Is it possible that I could have died?
Yeah, if it makes it to the point of that last stage, the tertiary stage of syphilis, it's definitely a possibility.
Okay.
So it's really good that you came in.
Thank you, nurse.
Yeah, no problem.
Knock, knock.
Come in.
Hi, John. My name is Erica. I'm a nurse here. I'm with Alicia, my colleague, and we're just going to come here and talk to you a little bit about your symptoms and medications and treatments and ways that you can make sure that it doesn't spread to other people.
Okay. Has anyone ever told you look like that doctor that's around here?
Funny you say that. We do even have the same name.
Oh,
it's kind of
okay.
confusing. So what you have is a sexually transmitted disease, and it can be transmitted through direct contact with another sore with someone who is already infected.
So, like you said, you've never had sex before, but it can be transmitted through vaginal, anal, and or oral sex. So, and in your case, you got it from your mom. Okay, so do you have any questions or anything for us that we can answer?
No, I just don't think it seems fair. I didn't even get to have the sex.
I know, it's hard, and it's really crazy how the body works and how it can be transmitted so easily.
Now nobody's going to want to touch me.
We'll work on treating you so that you are able to have sex.
Thank you.
Do you have any medication allergies or allergies in general?
Not that I know of, no.
Okay, perfect. Because the doctor has prescribed you a medication. It's penicillin G-benzathine, and it'll be given through an IV for every 4 hours for about 2 weeks, which means that you're going to have to stay in the hospital. We're going to be able to monitor you for about 2 weeks just to make sure that there's no side effects and that the medication is actually working. Is that okay with you?
Yeah, are they going to get rid of these really painful lesions?
And yes, exactly. So that's what the medication is going to be used for. We're going to try to minimize all your symptoms and make sure that you're back to normal.
So I have to stay for 2 weeks and I'm going to get an IV of antibiotics.
Yes, penicillin, yeah.
Okay.
And it's about for 4 hours, every 4 hours.
Yeah, and then we'll treat your sores because they do look pretty infected and they look like they hurt.
Yes, they're
And
sore.
that's okay?
Yeah.
Okay. Perfect.
Okay.
Perfect.
Thank you.
Yeah, no problem. Let us know if you have any other questions.
Okay. Come in.
Hi, John. How are you feeling today?
Oh, I'm feeling much better.
Any
Yes.
pain?
No, and all my rashes are gone.
That's amazing. How does it make you feel?
I feel very attractive.
I'm so happy to hear that.
I feel like one day I'll find somebody.
You will.
Okay.
So we've been told by a doctor that you're able to leave today, which is pretty exciting.
Yes.
But before you leave, we want to talk about your medication. It's important that you stay on your medication. Just because if you stop taking it, even though you feel better, it could spread to other parts of your body, and it could be worse again.
One thing that really works for me if I need to remember something daily is to set an alarm on my phone. So it'll let me know, okay, at 1 o'clock I need to take medication, or at 1 o'clock I need to go take the dog for a walk, or whatever.
Okay, yeah,
Does
I
that
can
make sense?
do that.
Yeah? Doable? Perfect. Do
I
you
have
any
one of
questions?
those smartphones.
There you go. And it's really easy to set an alarm. I can show you if you need help.
Okay.
Perfect.
So what you're telling me is that I need to take my medication so that I don't become infected again?
Yes, because it is very possible that if you don't continue your medications, your lesions and things can come back, and it can just put you back into the hospital bed. So we want to make sure that you are taking medications and living a happy life.
Okay.
Good.
Am I still infectious? Can I spread this still?
It is possible, but we want to make sure that you take all your medications before you have sex, before you transmit it.
So within maybe about like 6 months, you'll come back and we'll check, do a test. If you're negative, you're good. But right now, it's best to stay away from sex.
Yeah.
Okay.
Finish your
Yeah.
bottle of antibiotics.
Okay.
Yeah.
Well, I'll go to the gym and work on my body so that it'll
Perfect.
be ready for when I'm good to go.
That sounds like a really good plan.
Find that special someone and you're going to have sex. Make sure you use a condom.
And I wanted to talk to you a little bit about your signs and symptoms of because you have a possibility of getting it back. We just wanted to make sure that you're able to know what it looks like so that you can contact a doctor.
Okay.
Yeah, and so one thing you can do is also just examine yourself if you ever feel, like a little flu-like symptoms or not feeling good at all. You can just examine your own body if you have any lesions. If you do see something, come and see us. If you're not sure, just come see us anyway, just to make sure.
And it's also really important there's going to be appointments for you after your discharge. It's really important to make sure that you go to these appointments when they're scheduled and let the doctor know of any sort of situation. Even if it seems small, let him know, because it could show him that he needs to do something. So after we told you all of this, are you understanding? Do you understand what you're hearing? Any questions?
Yes. So when I find a partner, I'm going to wear a condom.
Yep.
If I wake up in my garden again and I got bumps on myself, don't assume it's insect bites.
Exactly. Yep.
And make sure I take all my medication.
Mm-hmm.
And if I have any questions, ask my doctor.
Perfect. It sounds like you understand things.
Yeah.
Perfect. And now you get to go home. So we're going to set up the discharge papers and you're ready to go home.
Great. Thank you, guys.
Yeah, of course. Have a great day.
You too.
Thank you.